Okay. Eddie's dying. So we're gonna cannulate Eddie. So this is an Avalon cannula. This is what you would use for venous bypass or ECMO, but they're using it as the patient. So this is your venous cannula coming from your patient.
Okay. And we were saying it was probably coming from the neck.
Yeah, you can come from the neck or the groin, or the chest.
Chest,
and then here's it's called a CDI probe. It's an inline blood gas monitoring probe, and it would attach to here. It would give you all your values for your venous blood.
Okay.
And then the next port you would come to is your bridge. So this is going to bridge to the arterial side. Okay. This is clamped when you're on ECMO.
Okay.
You would use this to trial off. You would clamp off to the patient and recirculate here through your system.
Okay.
Or if you were to get air in your system, you would clamp off to the patient, open this bridge, and somehow get the air out the best you can.
Okay. So,
Sampling port for whatever you need it for. Coming around here, more venous sampling. Here's your hemofilter return, which we'll get to on the other side. I'll talk about that after. Here's your venous pressure transducer. That's going to measure your negative line pressure. So just as you're draining from the patient, it's going to create a negative pressure, and you want to monitor that pressure. You don't want it to go more than negative 40. Yeah, you don't want it to pull too hard.
Okay, but yeah, hard. Okay.
Going into the pump, spinning around, going out of the pump. You have more sampling ports just for blood. You can put blood in here. You can do like CRT through any of these ports. That's a flow probe that needs to be clamped on. And this is an arterial pre-membrane pressure monitor. The blood's going to go through the membrane, out of the membrane. So you have a pre-membrane pressure, and then you have your... should have a post-membrane. Yep, post-membrane pressure.
Okay.
So what's important about that is to measure whether your oxygenator is still good by comparing your pre and post membrane. If your delta pressure gets really high, that means you probably have clot in your system.
Okay.
So that's why they do that. And then this little shunt right here goes to your arterial CDI probe, measuring the arterial blood gas.
Okay.
And then into your hemofilter, which is like functioning as your human kidney.
Okay.
You can pull off water.
You can pull off water, and can you add?
You can't add to this, but you can add on the other side and take off.
Okay.
And then it goes back into your venous system.